My name is Mercedes Curran. I'm president of Belmont Village, and I'm very pleased to welcome all of you to this very important information session. We're very excited about the information that we're going to share today, and very excited about the program that we have implemented at Belmont Village. But to learn more about it, I would like to introduce Patricia Will, who's the founder and CEO of Belmont Village, and always ever a visionary. And in this instance, no question about that in terms of the program that is being rolled out and described to you today. So without further ado, Patricia, I'll turn it to you.
Thanks, Mercedes, and welcome everyone. As many of you know, I'm the founder and CEO of Belmont Village, but I'm also a child of a resident of Belmont Village. My dad lives at our Hunters Creek community. He's 90 years old. And through the years, he's had chronic diabetes and heart issues. Many years ago, when I was doing board service for one of the major hospital systems here in Houston, I watched a robotic surgery being performed via telemedicine on an oil field that was off in Africa. And it struck me that someday we would be able to utilize the terrific advances in telemedicine to the good of our families and our residents. At the onset of this pandemic, we were challenged by so many things, but at the very beginning, what we discovered was that the hospitals in Houston, in Dallas, in Los Angeles, and in Chicago, the EMTs themselves did not want to take our residents. The ICUs were filled. They didn't feel that they were sick enough. And we had the challenge of arguing the point in an effort to triage residents with our nurses appropriately. In addition, many of our family members came to us and said, I don't want my parent to go to the hospital for fear that it's overrun with COVID-19. And indeed, given that we care for a vulnerable population, if only by its age, that is certainly how I felt. So we almost immediately looked across the country to see if we could find not only the best telemedicine technology, but the best practice associated with that technology, one that uniquely does seniors in communities like ours, so that along with our nurses, we could do a better job of triaging emergencies and, as appropriate, organizing visits to the doctor. In Tembo, we found my dream come true, in that the expertise that is brought to the table by the board certified physicians at Tembo that uniquely works with elderly seniors, and I'll let Dr. Gupta tell his story in a moment, really took my breath away. One of the things we know is that roughly 2/3 of the residents that go to the ER, one, don't need to go, and two, come back worse than when they left. In addition, I've had the personal experience of having a parent sent to the ER through the goodwill and the best expertise that the nurse on hand had. And then, because he didn't need to be there, paying the $800 ambulance ride to take him back to the community. To avoid all of this and supplement the terrific EMTs that do show up at our communities, and even the ER docs on the receiving end for those who do need to go, we've invoked Tembo, and in a moment, I'm going to let you tell their story. But I can tell you that as an adult child, I was probably one of the first to sign the consent forms because I realized how important this is, especially during COVID-19, but really period, because the best thing we can do for our seniors is keep them out of the hospital if they don't need to be there. With that, I'm going to transition to Dr. Gupta, who will tell his terrific story and also how Tembo works. Dr. Gupta, to you.
Thank you very much, Patricia. I'm going to share my screen and walk everyone through a quick presentation, and then we'll have some time for Q&A afterwards. Let's see here. Okay, I hope everyone can see my screen here. It says Tembo Health. Getting some head nods. So again, I'm Dr. Gupta. I'm a board certified emergency medicine trauma physician. I'm also board certified in clinical informatics, so I love to geek out, as they call it. Tembo Health, Tembo is actually Swahili for elephants. We chose that name because elephants are one of the few species on the planet that care for elders. And so we thought it was very appropriate and fitting, given that at Tembo, we only provide care for seniors, and we do that in partnership with senior communities like Belmont. Really allows us to leverage the infrastructure, the nurses, the database, and so forth, so that our team of board certified physicians can provide really rich, complex, quality care in working in close partnership with the nurses and the primary care physicians at the facilities and communities. So who's Tembo? Again, for me, the reason I got into this space was a very personal story. This is my grandfather, Paul, taking this picture of us about 5 years ago. He was 88 at the time. And he got a little bit sicker, ended up in a senior care community. And what I found through his experience was that he lost all his access to his care team. At the time, he was on 22 medications. He had 6 physicians, his primary care doctor, cardiologist, psychiatrist, neurologist, pulmonologist, and so forth. But once he ended up in a senior care community, none of those physicians would travel to the community to see him. And he was too frail to be transported from the facility to the doctor's offices to receive that complex care that he required. And so I just felt like telemedicine was the most logical solution to this problem. And that's kind of where the idea was born from, for me personally, at least. This is our clinical leadership team. So there's 3 of us on the team who are really driving the clinical workflows, our mantra and philosophy for how we want to approach care and provide care. I'm very blessed to be working with Dr. Wallens and Dr. Chander. Across the 3 of us, we have true expertise in internal medicine, emergency medicine, urgent care. We've all been friends for over a decade. We all met in Boston when we were training at Harvard Medical School. And we are the leadership front here. And really think really about patient communication, evidence-based care, and care setting at the forefront of our philosophy. We've been able to recruit many of our colleagues and frankly, many of our friends to join the Tembo practice. And we've really been able to recruit from very top institutions. This is a sampling of our board certified emergency medicine physicians. And it's a really wonderful, diverse group. We've got clinicians across the country. And we also have a team of specialty care clinicians providing care in areas like psychiatry, cardiology, neurology, pulmonary, palliative care, and so forth. In terms of what we do for telemedicine and how we provide care to seniors, we know that through many of our personal experiences and as we've been evolving the platform, access to physician care is difficult for most seniors and communities. Acuity has only increased over time in terms of need for complex care. And now with the pandemic, it's just really disproportionately impacted seniors in a very difficult way. And so from our perspective, we really want to come and provide that comprehensive concierge approach to healthcare, to wellness. So we've been able to launch our 24/7 emergency medicine platform in the Belmont locations in Illinois, Florida, and Texas. We will, as we continue to learn with that experience and enhance the program, we will be adding our routine specialty care. So again, residents can book cardiology visits, psychiatry visits in the comfort of the Belmont facilities without having the need to leave. And we also have a very wonderful vital sign monitoring program where we can actually track resident vital signs on a proactive basis, things like glucose levels, blood pressure, oxygen levels, and so forth. And we have a nurse team that can then help manage and create alerts in a very proactive fashion. In terms of our models at a very high level, we really care about partnership. For us at Tembo, this doesn't work unless we have the full buy-in of the nursing staff, the leadership team, the primary care physicians, and of course the family members as well. We worked really hard with Belmont to build EHR integrations, so all of our clinicians have full access to medical history, medications, allergies, diagnoses. We also have a nursing communication portal. We collaborate closely with primary care doctors in that every time one of our physicians sees a Belmont resident, we will send a copy of our doctor's consult note. One copy will go to Belmont and the second copy will go to the primary care physician, because it's really important to have closed loop communication so that everyone's on the same page and understands that, you know, a resident had an event on the urgent care side and what the action was, the assessment, the diagnosis, and so forth. So in terms of the Belmont Village experience, you know, especially with urgent care, it's always important to make sure that we can provide timely care and efficiently. So we've asked everyone to complete a consent form, which includes the insurance information as well. This allows Tembo the right to provide care and also to bill the insurance for the care. If you have this completed in advance, the visits can be much more efficient and we can be focused on assessing, diagnosing, and creating treatment plans, and not thinking about how do we find consent, how do we find the family member who needs to sign this consent, and so forth. In terms of the actual workflow, it's pretty simple. We're available 24/7. All the nurses and staff at Belmont have been trained in how to interact with Tembo. So anytime there's a change in the resident's condition, it can be anything from a fall, a fever, abdominal pain. You know, they go through the standard protocols. They'll alert the nurse. The nurse will make an assessment. If it's urgent, the nurse can call Tembo. If it's something that's non-urgent, the nurse can call the primary care physician. But let's, you know, in the instance when it's something urgent, the nurse will call Tembo. They'll be connected with one of our board certified ER physicians within 1 to 2 minutes. We'll then, you know, initiate a video visit, which will be a live visit. We have both deployed iPads and we also have telemedicine carts that are being deployed to all of the Belmont locations to really create that, you know, real-time experience. And one thing that we really value is, again, communication and collaboration. So every time one of our physicians receives an inbound call from Belmont facility for a resident call, our physicians will pick up the phone. We will call the family member because, again, we pulled that information from the Belmont EHR integration. So we know who the healthcare proxy is or the power of attorney is, the next of kin. Our physicians will actually pick up the phone and call that family member and say, hey, I'm about to see your mom or your dad or whatever the relationship is. Sounds like they took a fall or they've got a fever. I'm about to start this video visit. Would you like to join this video visit with me? And our doctors can send the family member a secure encrypted link via text or email to join the video visit in real time. This really helps us because we get so much additional information and context from the family member in terms of how the resident appears and how they're doing. But even more importantly, allows us to then have shared decision making to help, you know, really communicate clearly what we see as the diagnosis, what we think the potential treatment plan can look like, and does that involve keeping the resident in the facility, or do we need to consider sending them to the ER or the hospital for more advanced diagnostics or treatment? Well, I guess I went through during the call in terms of what's happening. Again, the nurse will be facilitating the visit the entire time. So we have things like digital stethoscopes, digital EKGs, otoscopes, and so forth. So the nurse can really help us get a really detailed history and physical exam during the visit. And then again, after the visit is completed and we've discussed the recommendation plan with the family member, the nurse, and the resident, our doctor will type up a full detailed report of the encounter. One copy will be sent to the wellness center at the Belmont facility, and a second copy will be sent to the primary care physician. So we've been live at the Belmont locations for 4 or 5 months now. We've had some really great success. In more than 75% of the time, we're able to avoid sending residents to the ER or the hospital. We always do our best to do a follow-up visit. It's pretty much close to 100%. And what I mean by follow-up visits is, like, if we see a resident for a visit today, let's say they had a urinary tract infection, we will do a follow-up in 36 to 48 hours to ensure that the resident's doing well, they receive their antibiotics, and that they are improving. Let's get a repeat on their vital signs and so forth, and then the infection is not progressing. If we see a resident that may have had a fall, maybe bumped their head or something slightly, but they were normal neurologic exam, they're not on blood thinners, and they were deemed safe to stay in the facility, we'll probably do a follow-up visit in 4 to 8 hours because we want to make sure it's much more tight, again, to do a repeat neurologic exam and do a reassessment. Again, we always invite the family to join the video sessions, and we've had very high success on that as well. Again, it helps us provide better care to the residents, and frankly, communication is just so critical when you're talking about senior care. Just wanted to highlight the telemedicine cart. This is actually a picture of the cart that's going to be deployed in the next few weeks across all the Belmont facilities. It's going to be equipped with some really high-end technology like digital stethoscopes, digital EKGs, and we've already started partnering with local vendors in all the Belmont communities to help facilitate blood work, COVID testing, x-rays, ultrasound, and so forth, which again, just really allows us to provide so much more complex care in the comfort of the facility, because these vendors will they have mobile units. They'll actually come into the Belmont facility to run these tests, and then those tests are submitted electronically, the results back to our team, and then we can do a follow-up visit, and in that follow-up visit with the resident, the nurse, and the family member, we can review all the results of those tests as well. So it's been a really wonderful tool. So I'll just finish up with some quick case studies, kind of highlight some sample cases that we've had. So we had a resident, recently, or a few months ago, I think this case is from, an elderly resident, took a fall, had a minor bump on the head, but no significant trauma, also landed on the left hip, so had some left hip pain. We were able to, assess the resident immediately, invite the family member to join the visit. The patient was deemed by the physician to be safe, doing well. There was no risk factors in terms of blood thinners or other medications that would increase the risk for a head bleed. Totally normal neuro exam. We were able to order a hip x-ray. The vendor came in, did the x-ray. We had the results within 3 hours. And because there was a minor head injury, we ended up doing 3 follow-up visits within 24 hours. We did a follow-up visit at 8 hours, 16 hours, and 24 hours. The exam was unchanged for all of those visits. The family member was able to participate in every single visit as well. And ultimately, the resident did really well, and we kept them out of the ER, out of the hospital, avoided what would have otherwise potentially been a very traumatic experience going to the emergency room. Had another case. This is actually when we first launched in one of the facilities over the July 4th weekend. There was an elderly resident with some abdominal cramps and discomfort. We were able to initiate a telemedicine visit very quickly. The physician was concerned for a UTI. We were able to get the urine tested, which did show up a urinary tract infection. We were then able to put in a prescription for antibiotics, which were then delivered to the resident on the same day. And when we did a follow-up the next day, the resident was feeling much better with antibiotics. And again, this was a holiday weekend. The primary care doctor was unavailable. And had it not been for us, the resident would have ended up either in the ER or would have had a delay in access to antibiotics for 3 to 4 days. So again, it was a really wonderful experience to just provide real-time care, high quality care in collaboration with the nurses at Belmont. And that's all for the presentation.
Thank you. I want to let everybody know that we do have a Q&A function in the webinar, so that if you have questions, you can type them in and we'll be looking at them and answering your questions here. If we run out of time, or if you would rather have us follow up with you after this phone call, I will provide an email address for that in a few minutes, so that you can also reach out to us beyond this webinar, so that we can answer your questions. But before we get started with any questions, what I'd like to do is ask Kimberly Hundley, who has joined us today, to share some of her personal experience. We heard a little bit from Patricia and her experience within the decision-making with her father, who's a resident at Belmont Village. But then Kimberly also has her father lives with us and was treated with the help of Dr. Gupta's team in recent days. And we want to share that experience so that you have a personal account of how this really works, and what to expect if you're ever in need and use this service with us. So Kimberly, if you don't mind, I guess I'll turn it over to you.
Gosh. Well, thank you. And of course, a week ago, I would have never known I would have been on this call. So Saturday night, and of course, everything happens off hours when it comes to medicine. Having 6 kids, we've never had one child that really gets sick during the day. So it happened weekend and in the evening. The nurses are great at Belmont, and the nurse that we had was really monitoring my dad's blood oxygen level, and it was ambulating up and down during the day. And she really kind of started getting concerned about it that night. So she called Dr. Gupta's team, and immediately, I couldn't believe it, got on a televisit call, and they called me on the other line. And of course, my dad's thinking he's fine. I'm fine. You know, his little East Texas accent, I'm fine. And but it was really enough that he did need care. And I didn't want to be waiting until Sunday. I mean, even Sunday, I would have had to take him to an urgent care or the hospital. And, you know, everyone with, you know, who's sick is going to those places. So it was just great being able to be evaluated. We did end up going to the hospital just because he really needed to. And everything checked out. He didn't have COVID. They did a COVID test. But unfortunately, when he got to the hospital, they didn't do a COVID test, which I was really surprised being in this age group. And 2, his levels looked fine once he got to the hospital, which was really odd. But I did ask them to do a COVID test because I didn't want to have him going back into Belmont without being tested. It came back fine. He was fine. But the thing that was so impressive is that Dr. Gupta's team circled back around and really felt like he should have a few things looked at. So they ordered an X-ray, an EKG, and so far everything looks good, but it's something that we're watching. But it was really nice knowing. I think I would have second guessed myself if we hadn't gone to the hospital that night, but then I would have felt guilty sending him to the hospital because of COVID, if it wasn't necessary. So this was just a great experience. I know that this won't be our one and only time. This is, you know, there's always something that comes up, and it's so nice not having to have him taken to the hospital or having to pick him up to take him into that environment unless the doctors feel like it's necessary. So.
Thank you. I'm glad we are very attentive, and Dr. Gupta and the team are working very closely with our team. So I'm glad to know that you felt the support, and it's just, you know, especially like we were saying, it's always important, but during this time, it's especially so. And so I'm glad that you were able to receive that service.
Well, and let me say one more thing too, is that my dad really enjoyed, he said, those are the best doctors. So he really enjoyed the visits. So
I don't mind telling you that we did multiple options, and because of that very personal connection, that was a very important decision point in our decision to join in partnership with Tembo. So I agree with you. Thank you.
Thank you.
We've been collecting some questions here, and I'll try to combine a few of them that have a similar theme. So I will start with the question of whether this is covered by Medicare. Is it covered by all insurance? What is the cost for a visit? Dr. Gupta, would you like to answer that?
Yes. So Medicare and all commercial insurance, including even Medicaid, covers telemedicine visits, and so we're going through the standard protocols. I believe almost the vast majority of residents at Belmont have Medicare as a primary insurance. All of our clinicians are in network with Medicare, and so we will always bill the insurance. And if you have a supplemental plan, that will help cover any copays that may exist as well. And so I don't believe we've had to send out any individual claims for any of the visits we've done in the past 4 months for the visits that we've had.
Great. And, you know, an important question, and I think in terms of process and us really launching this to the full effect and full benefit for all of our residents, the question of as to will Tempo be automatically used if the need arises and a consent has been signed? So I guess I will start the answer, and then Dr. Gupta, if you want to add anything. That is absolutely the case. Our intention is for all of our residents to participate in this service. And we do need to collect the consent forms for that to be completed as a process, if you will. But the intention is for us to have all of the consents in hand so that all of our residents can use the service.
Mercedes, if I can just add that on the newsletter that announced this call, there's a link to the consent form. It's very short and simply asks for pertinent information. The rest of the health information, as Dr. Gupta mentioned earlier, his team can access from our records or visiting with the doctors that normally take care of our residents. But that link is important in order to be able to get the information. Nobody ever knows when the emergency is going to occur. Although I agree with Kimberly, both with my children and my parents, that nothing good ever happens after midnight. So I would urge everybody who to click on the link and try to fill out the consent form. It's a value add. It takes away nothing, and it really can add some value, particularly in these times.
Another question that we received was about somebody was asking if they had to indicate specifically that they wanted to be included in the consult. And I know that it's been talked about, but maybe it's worth repeating a little bit of how it works to get the loved one on the line to join us for the consult.
Yes, happy to share some more color on that. So again, basically the workflow is that the nurse will call Tembo. They'll have a quick conversation about the case, and then just in case there's a need to call 911 or anything like that, the physician can help expedite that type of decision making. But if a telemedicine visit is going to start, the nurse will then bring the equipment to the resident's room. They may start the primary assessment, like getting vital signs and so forth. In the meantime, the physician will look up the patient's information, and then the physician will also call the family member. That is our standard protocol. We will call you 100% of the time. If we don't reach you, we'll leave a short message so you can call us back. And then assuming the family member does respond or call us back, we will then invite them to join the video visit. If you're unavailable to join the video visit, you can have someone else in your family join, or the doctor can then call you back after the visit is completed to then discuss kind of like the assessment, the diagnosis, and the treatment plan. And then again, we really value shared decision making because these are very complex decisions. Whether it's getting an antibiotic or assessing a fall and so forth, we want to make sure everyone is on the same page.
Thank you. And we have, as if just to add to that, we obviously have information about each one of our residents, and we have contact information and other information in our own records. So, you know, this is something we have not had any problem with, and we feel is, you know, a very important part of the service. So, you know, our intention is to try to get somebody to join us and to be informed about what is going on. And, you know, we'll work with Tembo to make sure that that information is always available. I have a question about, somebody says, my preference would be for my loved one to not go to the emergency room. In fact, the question goes on to detail, even if they fall, you know, it would be my preference to not have them visit the emergency room. How would that be dealt with?
Yes, I mean, so with every case, when we evaluate a patient, we're going to do a full history, physical assessment, diagnosis, and then we will discuss the treatment options with the resident and any of the family members that are involved. Everyone at Tembo Health, we take a very consultative approach to medicine. So we're not going to tell you what the answer is. We're going to provide you with a menu of treatment options so that you can kind of understand the risks and benefits of those various options. And so depending on the severity of the illness or the issue, going to the ER may be an option. I can say that we have had a couple of cases where the physician did feel that it would be in the best interest for the resident to go to the emergency room, specifically like to get a CAT scan or something of that nature. But there were situations where the resident was DNR, had fairly advanced dementia, and both the resident and the family member, really the family member in those cases in particular, when it was a dementia case, really didn't feel like it was in the best interest of the resident to be going to the emergency room and kind of going through that traumatic experience of being in the ER. And so they decided to keep the resident in the facility. And again, because the resident was DNR, the physician said, that is a reasonable choice to be making, and we can support you with that. And again, we did it's particular for those cases, we did very frequent follow-up sessions just to check in on the resident, do a quick neurologic exam, make sure that nothing was changing. Because I think what is important is when you make a decision like that, where you choose not to go to the ER or you choose not to receive more advanced testing or treatment, is to just make sure that everyone understands what's unfolding, right? And we want to make sure that everyone has the right access to the information and data. Because what I could imagine happens is in all of these cases, the residents always ended up doing well, and they did not end up needing to go to the ER or have any worsening of symptoms. But if someone's exam was changing, let's say we had an 8-hour visit and their neurologic exam was evolving, I can imagine that the family member may want to change their decision in the moment, or maybe not, but at least we want to make sure they have the information available. Sorry for the long-winded answer there.
No, that's very, very helpful. Thank you. I know Patricia has answered some questions in the chat. For anybody who has access to that, you might see a few questions that I think have been answered actually throughout the discussion. For example, in the residence records, we will have noted if there is a DNR, which was a question in particular that has shown up a couple of times now. One question that is more sort of overarching. It's from. It says, "It sounds wonderful. It's very smart. What has been the greatest challenge and the greatest benefit of telehealth visits?" So maybe this is Patricia and Dr. Gupta who might want to share this answer. Patricia, would you go first?
Well, I'm going to go first for the challenges and say the greatest challenge is the most mundane, which is obtaining consent forms. Obviously, if we're going for the best service for emergencies, we don't want to be trying to get a family member or the resident themselves to sign a consent form in the throes of the emergency. So that's a pretty mundane challenge, but it's real. The other is more understandable in my view, which is in great cities like the cities where we live, be it Austin or Chicago or Fort Lauderdale or Houston, where most residents have a stable of physicians. Some people perceive a conflict between this service and the great service that a parent has been experiencing all their lives. I can't stress enough times how we see, and Dr. Gupta and his team see themselves as a complement to your stable of physicians, including and especially the primary, and not in conflict. We do have some people who will migrate to Dr. Gupta's service either because it was great or maybe they didn't have a physician to start with. But we by no means see this as a substitute. And that has been a challenge in terms of people's understanding, even was a little bit of a challenge for me at the beginning, but it's a complement. So I would put those as the challenges. As for the upside, from my perspective, anytime we can supplement our nurses, and our nurses are on site 24/7, but anytime we can supplement them with board certified Harvard docs in order to make good decisions with technology and experience, and keep them from having to go to the hospital. I remember one time when my father-in-law was sent to the hospital from one of our Belmont villages, he had left his hearing aids on the night table. So he had a really difficult time. We were out of town. He had a really difficult time communicating in the ER. He was left to wait because he wasn't really urgent. So obviously the heart attacks and the gunshot wounds come first. And I can tell you that he came back in worse shape than he went. So anytime you can avoid that, forgetting the cost of the ambulance back, it's to me a big win. With that, Dr. Gupta, you can share both your challenges and your victories.
Yeah, I mean, I think I'll echo the issue on the consents. We've had a number of urgent care issues where we're trying to complete the consent in real time. And it's always challenging to try to, find the power of attorney or family member or whoever it is to get them to sign the consent before we can start providing care, which obviously in an urgent situation is very frustrating. In terms of like the wins, really from my perspective, like the most wonderful thing that we've really been able to achieve is partnering with the nurses. The Belmont nurses they're so passionate and they really care about keeping the residents healthy and well, and so just getting that engagement from them has been really great. And then I think second is really getting a chance to involve the family members. We had the idea that we always wanted family to be involved, but it's been really wonderful in terms of having the additional context and information from the family to let us know, hey, mom looks really great. She's smiling and really, chatting, like she looks like her normal self. That is a really valuable piece of information for the doctor to know versus, oh, wow, mom looks a little dazed and confused. Sounds like she bumped her head. She doesn't look like her normal self. We don't know what mom looks like normally because we've never seen or met her before. But having that additional context is so valuable and allows us to provide really just the best, diagnostic decisions possible. And then finally, just that shared decision making, right? Because it can be scary, when you're trying to make a decision. Do I send someone to the ER? Do I not send someone to the ER? If they go to the ER, they may be exposed to COVID. They may fall and break a hip, because they're not going to receive the level of attention that they get at Belmont. But making sure that we can make that decision in concert with the family makes our jobs easier, frankly.
Thank you. And I think we have one last question here, and it might be a great way to finish today. The question was actually more specifically about the cart capabilities and how that really works in preventing the ambulance trip. But Dr. Gupta, I think if you wouldn't mind answering that in the context of the possibilities, and you said you started talking in your presentation about the services that you're starting to add that are supplemental, but nevertheless will complete your ability to diagnose and maybe even treat someone at home at Belmont Village, and what that really translates into in terms of possibilities over the short term and then even the long term. And I'm not talking about necessarily taking more primary care and other specialty care services, but in an emergency, what can you do with what we have now and the rest of the services that we are assembling so that people can receive the best care possible at home?
Yeah, so and there's a lot of things there in terms of the emergency situations. I think one of the most important things is just getting timely access to the right expertise to make that diagnosis and treatment plan. And so, again, with Tembo Health, your loved ones will be connected within minutes to a board certified ER physician. We have the wonderful nurses at the bedside who can help facilitate obtaining history, vital signs, temperature, heart rate, blood pressure. But then the nurse can also, utilize our tools that we have. So we have a digital stethoscope. The nurse can place that over the chest and over the back so the doctor can hear the heart sounds and the lung sounds in real time. We have a digital otoscope, so we can look inside the ear, nose, and throat, especially if there's a fever workup or any congestion and so forth for infection. We have a digital EKG, so the nurse can now, get us a very instant EKG, which is an electrocardiogram of the heart, so we can assess for heart disease, lung disease, and so forth. And so all of those tools, and then the ability to order blood work and x-rays from outside vendors, really kind of gives us almost, all of the, or not all of the, but like a lot of the capabilities that you'll have in an emergency room setting. We can't do CAT scans, we can't give like IV medications and so forth, but short of that, we can do almost everything else. And I think what the real value in addition to that is the follow-ups, right? You're gonna have a follow-up by the same team, whether it's in 6 hours or 24 hours or 48 hours, and we're gonna, reassess the resident and see, are they improving, are they not improving? And then on every one of those visits, we invite the family to join. So I think the capabilities here are really fantastic, and I'm very excited for the potential to continue to grow the program.
So this will be made available. I believe it's being recorded and will be made available. I know some of you have asked if you can share this with your families, and so that they can also be informed. So we'll make this available. We will also be able to receive and respond to additional questions through our general email address, which is comm@belmontvillage.com. So communications@belmontvillage.com, essentially comm@belmontvillage.com. If you would like to send any follow-up questions, we will make sure to respond to you and address all of your questions. Patricia, would you like to have any closing remarks?
Well, all that I will say, and I say this again from the heart, as a child of a great parent who lives at Belmont Village, but also as someone who has the responsibility of doing the best job we possibly can vis-a-vis all of our customers. As I think about, as we approach Thanksgiving, and I think about every day, I keep a journal and I do my little note of gratitude every morning. And as I think about the silver lining in the cloud of the innovation that we've been able to come up with during this very, very difficult period for all of us, this is one of the bright spots for which I have a debt of gratitude. I have a debt of gratitude for all of you, and wish to thank you for coming today. Please consider this as part of the repertoire that we can bring to bear in order to make things as good as they possibly can be. Through this pandemic, yes, but potentially forever. Thank you so much for coming today.